give me patience, yeah.
Little glitch in the audio there, Logan. I heard 2 1 2 3s.
No, it's all good. I'm just checking on Facebook if our audio is good. And I got a snowman here.
You know what? Do you want to build a snowman? I do. Guess who these two are? Z-Pack. Dr. Dementia, and Dr. Dementia. Thank you for joining me. This is Z-Mom, my mother.
Hello.
A physician, a psychiatrist, also my mother, as I mentioned. And this is Z-Dad, physician, internist, private practice, also my father. So Rustam Dementia, Shireen Dementia, Zubin Dementia. 3 generations of Dementia. Welcome to the show.
Good evening. All our friends and no friends, foes, I'm sure you're thrilled seeing us tonight.
Yeah, we're all very excited to talk about physician impairment. No judgment. No reason that I chose these two, just that they're my parents and they happen to be in town. We just ate dim sum at the Dim Sum Cafe, which was the place that Z-Pup and I were live from that took an hour to serve us the food. Today they made up for it in spades. I highly recommend it if you're in Vegas. And we all are bloated and postprandial. And now we're going to talk about probably the most important topic that we've talked about in a long time, Z-Pack, and that is what to do if a physician or a healthcare professional that you know is impaired. What does it mean? What does impaired even mean? What are our sort of ethical, moral, and legal responsibilities to report? And why is it one of the most crucial questions to actually answering how we can work together culturally to change the culture of medicine, to support each other and our caregivers so that we can take care of our patients? The ultimate goal is keeping our patients safe while keeping ourselves safe. So I thought having a psychiatrist, having an internist, and having whatever it is I am, a hospitalist, talk about it would be good with these two clowns over here because they're muggles, they're non-medical people. And both of them are chronically impaired. So let's start. So Z-Dad, what is it, people say impaired? It seems to me like a euphemism, like, oh, he's touched by something. Like, what does impaired even mean?
Actually, impairment is in 3 categories. One is substance abuse, out of which alcohol is the most common.
Right there. Check.
10-15% of physicians are actually addicted to alcohol.
So actually qualify for alcohol use disorder, et cetera.
Yeah.
Yeah, that's a lot.
And then the other is prescription drugs.
Yeah.
So they're addicted to that.
They're getting high on their own supply.
Getting high on their own supply. That's right.
Very true.
And the third is street drugs.
Mm.
And the other category is physical. Alzheimer's disease, dementia, and actually, for statistic-wise, 3 to 11% of all people over the age of 65 have some sort of dementia.
Mm-hmm.
And remember, 18% all practicing physicians today are over the age of 65.
Whoa, so 18% Z-Pack of doctors are over. Logan's coming over here, which means...
Just got to fix Z-Dad's bow tie, Mike.
I'm telling you, the bow tie will get you every time. Every time. That's why they don't wear on TV, okay?
Bow tie is the way to go.
Do you want to make it lower? Doesn't cooperate. So anyway, so while he's fumbling with the wardrobe malfunction, this is the kind of professional show we have here at Z-Pack. He's basically, all right, check. So 18% of practicing physicians are over the age of 65. This is actually a significant number, and I'm not sure about other fields or industries. In the airline industry, for example, you don't see that happen because typically either there's mandatory retirements or they have very strict sort of guidelines as to who can fly. But in medicine, that isn't necessarily the case, although this has come up quite a bit that people are constantly wondering, should we be testing older physicians for impairment and that sort of thing.
Ooh, Z.
Yeah.
Jen says, what about sleep impairment? I thought that was called just like being a doctor.
That's called being a doctor. You got pulled over once, Z-Mom.
Yes.
Tell us the story.
Yes. I was a psychiatrist attending in 3 different psychiatric hospitals. So by the time I went to the third hospital, I was coming home around 9:30 or 10 in the evening, and I was stopped by the police, sirens and flashing lights. Didn't know it was me, didn't pull over, got into trouble. The police officer got me out, made me walk the line, did a breathalyzer and said, "Ma'am, you're not intoxicated." So when I told him I was extremely tired and sleepy, he gave me a very kind admonition and said, "Take care of yourself, drive safely home, and don't do it."
So in a way, you were an impaired physician then.
I wasn't, and I learned my lesson.
Right, because you could have run into somebody, you could have hurt yourself.
Would have been a disaster, a
Right.
catastrophe. And I learned from that incident that I would never, ever drive if I was...
So we had a resident who ran into a tree post-call. I mean, he broke his leg. These things happen. So there's different degrees of impairment: physical, mental, substance abuse.
Yeah. And mental is what? Depression,
Oh,
anxiety, suicidal tendencies, bipolar. These are all
schizophrenia.
mental
Schizophrenia, yeah, schizoaffective. So you, obviously, have you ever had to treat physicians suffering with mental illness? As part, yeah.
A couple. Now I'm talking about in the mid-1980s, physicians with mainly alcohol dependence. But my colleagues in residency have been, we always knew there was something not quite right because they were circumstantial and tangential until they became floridly psychotic.
This was a colleague in residency.
A colleague in residency, and as an attending at the VA, one of the residents. And the sad thing about it is even the attendings tend to kind of overlook things until it becomes absolutely full-blown.
Yeah, so it's a physician heal thyself kind
Yeah.
of thing, all right? So
Substance abuse, that reminds me, I actually recommended a resident, a friend of mine, for residency. And the chief of staff one day called me from the VA hospital and said, "Do you know you recommended this doctor? He's a really fine doctor, but he's addicted to morphine."
Yeah.
But
See-
eventually he got over it.
yeah, because a lot of people do, see, this is the thing, Z-Pack, like a lot of people don't realize, recovery from addiction happens more commonly than the press will report. Most people actually, given the circumstances, will eventually get better, and so treating it in a disease model is actually very appropriate if people are willing to get help. Now the tricky part is when the doctors aren't willing to get help, or they're in denial, or they're worried about their license and they don't get help, then certain ethical obligations come to the fore, which we'll talk about in a bit.
Ooh, Z, I have a question about treating it in a disease model, right? Doctors are special cases, though, because they can't go on, like, you couldn't put a doctor on Suboxone, could you? You couldn't put a doctor on methadone. You know, they can't go on replacement therapies. It has to be abstinence only, doesn't it?
Let's really think about that, because the question is there anything that you're doing, taking, or encountering that will interfere with your ability to practice your job at a safe level for patients? And if the answer is no, and you're on, some medication therapy, and again, I'm not going to speak specifically to methadone or Suboxone, any of that, is that okay? And we're going to get to that as a question of what should state licensing boards even be asking us? Because right now, if they ask you, do you have any mental illness? That can be horribly sort of off-putting if you're trying to encourage physicians to report when they have illness and get help. If they're afraid that it's going to affect their licensing, which in many states it does,
Yes.
because they're asking the wrong questions on that form, instead of asking this question, is there any illness, medication, condition, mental illness, whatever, that you have currently that interferes with your ability to practice medicine safely? That's the question. Because if you have treated bipolar, that disease is not interfering with your ability to practice medicine.
Exactly.
The concern is people don't report, and Stat News did a piece where they actually studied this, and they found a good percentage of surgeons are afraid to talk to anybody about their mental illness because they're afraid it's going to affect their licensing.
Yeah.
Now that is if the idea is to keep patients safe, if the medical board is to keep patients safe, isn't that the opposite of what we ought to be doing? So that and we'll talk about that. But so what are the signs, like if you're looking, look, a lot of us have doctors that are impaired and we've seen it. a lot of us have had colleagues or nurses or other people in the healthcare space that have been impaired, and we've recognized it. But what are some of the signs for like a patient or a person who's never really dealt with this? How will they tell someone's impaired?
Well, there are basically two categories: overt signs and subtle. Overt signs are coming to work intoxicated.
Yeah,
That's
People do
obvious.
that.
Yeah.
We had a
Oh, yeah.
we had a guy at the VA, a radiologist who used to do that.
And my own,
Yeah.
years ago, my own OBGYN, bless his heart, would be reeking of alcohol, and I knew it, and I couldn't do a thing about it. Didn't do a thing about it.
Why? Well, we'll get about why you didn't do that, because that to me is an interesting question. A lot of patients, a lot of colleagues sweep this under the rug. Some of it is deference to authority. Some of it, we'll talk about fear of retaliation, fear of being wrong about it, fear of being in a glass house and throwing stones, like you've got your own
True.
skeletons. That was always my thing, Tom. Like, I would never report anyone for crack because I'm like, they just need to look in my bag. And there's a lot of crack there.
You'd be like, what I do on the weekends is none of y'all's business, okay?
Exactly. I like to party too.
And the other overt signs are using drugs. Just like my friend was using morphine when he was a resident. So he was obviously there.
This
He
was
using it.
the access to it, right?
Yeah,
But this
he had
was,
access to it.
This was back in the day when morphine was like a cool drug to do. Now all the drug addicts say they're allergic to morphine, so they can get something much stronger, like Dilaudid or fentanyl or something like that.
Then if you notice some behavioral changes,
Like what?
Moodiness, depression, distraction. They're distracted. They're not really listening to you.
This is Tuesday for me. Like, this is just every day for me. How is that different than just me being an asshole?
You can tell. You can tell the changes in that particular person. Either he's speaking more rapidly than he usually does, or he's withdrawn. He's not paying attention. Reeking of alcohol.
So those are more obvious signs.
Yes.
So,
garble speech.
but what about some subtle signs like they're
Well,
irritable?
subtle signs
yeah.
are professional errors,
Yeah.
like a surgeon making professional errors, and I can give you some examples in the next
Yeah,
segment.
but that's
Yeah,
not
well,
subtle.
you know, I
Anger,
yeah.
showing anger.
Irritability.
Irritability, absent, not coming to work.
This is like Tom and Logan. How is this there? I mean, these two, lucky they don't actually touch patients, or do they?
I get high at work every day, you guys. It's great.
Actually, this is the first time you're not wearing your sunglasses.
That's
Are
right.
these just
I
your
have my
standard-
regular glasses
Your regular
today.
glasses. You look so professional.
Thank you. Thank you.
And constantly complaining of headaches.
They
That
don't
could be a sign.
So these are subtle signs. Marital
subtle.
difficulties, financial
Poor
problems.
hygiene,
Right.
withdrawn,
Getting a
marital problems,
DUI.
financial problems, DUI,
Yeah.
poor health, it could be.
Well, so then the question is, and I know, I mean, we could dig it deep into that, but I'm not sure we need to so much. You have cases, and so ZDadd actually being, how old are you now? Can we tell them?
I am within the 18%.
Right. So this becomes an existential question because you always want to ask yourself too. You want to self-regulate and go, "Am I competent to do whatever?" You still see patients in a disability setting,
Yes.
and so on. But you closed your practice because it just was too much, right?
Yeah.
Yeah. So at some point you start to slow down and you do what's appropriate for what you want to do too.
Yes.
But there are people who don't do that. So they're still practicing surgery. Your own surgeon who did your paraesophageal hernia repair had Parkinson's,
Right,
unreported.
right.
And how did you find out about this? Because of the complications you had, or was it something else?
Well, the surgery didn't go well off.
Yeah, I remember that.
Yeah, you remember that. And then I was told by another physician that when he was assisting this particular surgeon, he noticed his hands shake.
Oh boy.
Oh boy, I know.
And a couple of years later, he was a younger surgeon,
Don't say his
Buffalo-
name, by the way.
No,
Yeah.
no.
Yeah.
and he actually was admitted to a nursing home, and he died prematurely from Parkinson's
Oh my
disease.
gosh. So, okay, ZPAC, understand this. You have 3 doctors here. We have all at some point in our careers encountered impaired colleagues or treating physicians for ourselves. So my dad's surgeon, and you gotta understand, my dad had a lot of post-operative complications. We don't know how much of that, like, your phrenic nerve was cut
Yes.
inappropriately, so half his diaphragm is paralyzed. He had bowel obstructions, which could have been an unrelated thing. But again, the question is, was this impairment, the tremor at the time, responsible, or was it something else? Was it just bad luck? Whatever. We don't know. Then my mother actually had a physician, the OB-GYN, who was alcoholic. What else?
And late alcoholic and a drug addict, bless his heart. And then he had hypothyroidism.
In the southern sense, right.
Yes, hypothyroidism with severe tremors. And I used to just pray that I wouldn't have to undergo another procedure with him. And bless his heart, he did pass away also prematurely. But I never could, I didn't want to leave him. I'm fine. I just didn't want to leave. I just didn't.
So you stick with him until he died? Because I remember you calling me and saying my OB-GYN died, and you were very upset.
The year you got married, yes.
Now, yes, and here's the thing. There's been data on this. Robbie Pearl, in his book Mistreated, actually, we had him on the show, the CEO of Kaiser, which, by the way, I remember one year ZDadd told me, don't ever work for Kaiser because you'll be a cog in the machine. And then I went and worked for another cog in the machine. We're all the machine now, and Kaiser may be actually the cleanest machine. Anyway, so Robbie Pearl in his book wrote about why patients, even when confronted with evidence that their doctor is impaired, not the best doctor, doesn't really know what they're doing, they stick with them. And there's a lot of things. There's some of it's an authority thing, some of it's a social thing, some of it's superstition and fear. It's a primal fear that if I go against this healer shamanic figure, something bad will happen to me. And you have a relationship with them that has nothing to do with their competence, but more with a trust that you have with them. So all those things mean that that impairment is underreported. Now, colleagues don't report because we have a code of ethics. We have a code of honor. It's not ethics. Our ethical code said we should give them, and all the state boards say this pretty much. They say it is our ethical responsibility to make sure that physicians who have substance abuse, mental illness, physical impairment that affects their care of patients get help. We help them get help. If they refuse to get help, then the ethical and in some states legal obligation is to report them either to the medical board or to the hospital authorities that are responsible for physician aptitude, et cetera. But we don't. A lot of the times we don't. Some of it is a code of silence like police have because we all in this crucible together and we feel, this is just me thinking, we feel like we're hurting a colleague and his livelihood and someone who worked so hard, and maybe they can get help, maybe we're wrong about them, maybe they're going to retaliate, maybe, et cetera, et cetera, et cetera. And there's a million reasons why we don't do it, but ethically, morally, legally in some cases, we have to.
Yes.
And this is something that, again, I want to impress on you guys. I know it's really hard, but the first step is helping them get help. And if they can't do that, they refuse to do that, it's our obligation to protect patients and the treating clinician from harm.
Absolutely.
So was there anything you wanted to say about that or any other piece of that?
Well, do you want just one or two surgical experiences?
Yeah, give me a surgical example.
Like, for example, a patient has a laparoscopic cholecystectomy. And the surgeon signs off without making sure that patient is stable. He gets a call in the night that the temperature is up, the blood pressure is down, and the surgeon doesn't return the call.
We've all been there. Yeah, nurses, hospitalists,
You're right.
ICU guys.
And the next day, the patient is in the ER. The ER doc does a CT of the abdomen, finds internal bleeding, goes for a patient to send for another surgery, and has to have his cystic artery ligated.
Because it was never clipped.
Because it was never clipped.
And now, guys, so you know,
Poorly clipped.
Poorly clipped in a cholecystectomy, that's a key thing. You clip off the cystic artery. And again, I'm not a surgeon, so don't take anything I say as medical advice. Don't go do your own cholecystectomy. But if you don't clip it, it can bleed, it can ooze, you can have catastrophic complications.
Now, the allegations would be that there was negligence involved because he never returned the call.
Yeah.
And he didn't provide sufficient coverage. And the other part would be that negligence, yes.
But it could have just been a complication.
And it could be a
Yeah,
complication.
right.
So the defense will argue that, yes, bleeding is a complication of surgery.
Yeah.
But they will also agree that negligence was a factor.
Right. But then what ended up with this doctor? turns out he had
Well,
something.
it turns out that he was addicted to alcohol and drugs.
There you go. So now, on the stand, okay, it's an incredibly difficult defense, right? Because this guy is impaired, unreported, negligent, and the patient had a fatal complication. So again, legally, ethically, morally, ultimately this is about our patients. This patient died from a procedure that my mom had and is sitting here with us. It's a common procedure. Why did it happen? Probably a mix of things. We can't say, but we know that the impairment from drugs and alcohol certainly didn't help and probably contributed to this, at least in theory. So that being said, right?
Then you want another case just for an example?
I think you know what I want to do is I want to read a case.
Yeah.
Okay.
Because
Let's go for it.
this one gets to the heart. Is there anything else you wanted to say about impairment?
Why don't we report impairments?
Right. And we were saying it's a lot of different things and a fear of retaliation, et cetera. Well, here's the thing. So
They don't know.
what do you
A
mean?
lot of people say, I don't know how to report it.
Right. So if you don't know, there's a thing called Google where you can find out. But people literally, they'll say, I have no idea who I tell. I'm worried. I get messages, Z-Pack, from healthcare professionals. I work with a doctor. I work with a nurse. I think they're diverting drugs. I think they're doing this. I think they're committing Medicare fraud. I think whatever. What do I do? And I'm like, you don't email a stranger on the internet and ask that question. You go to your supervisor. You Google a legal question, you talk to a lawyer. It doesn't matter. You find the answer and then you follow up, because to not follow up, again, is an ethical lapse on your part. And you can be legally responsible for
Yes.
that. Absolutely. So remember, it's not just about covering your patients, covering your colleagues, it's about covering your own butt.
By the way, Holly Dixon says nurses have an aggressive diversion and probation program, but MDs do not.
Yes,
Yeah.
this is true.
Yes.
And Melissa Christensen says that, basically, she says she caught a nurse who was an ICU nurse who was drunk, and she reported her. She went through diversion. That nurse got treatment and now basically thanked her for reporting her, so she was able to get clean.
Man, I have had nurses and docs message me and tell me stories of their own addiction and how they were ultimately caught, and how that being caught was the best thing that ever happened to them, because they were in such a spiral that something terrible was going to happen. So again, in a way, you are doing this person a service by reporting and doing it in a compassionate way. You want to make
That's
sure,
important.
right? You want to make sure you're right. You want to make sure, and you should talk, ideally you should talk to them, right?
Talk
But-
to the patient.
talk to the
impaired
physician,
surgeon,
impaired
yes.
doctor, and it's terrifying to do that. But you have to. Now here's a twist on this. I did a piece recently about a VA surgeon in Washington State or Oregon, I forget exactly where, who was kicked out of his program, having just signed up, and all his staff messaged me and said, "This is one of the greatest surgeons we've ever worked with. He's a hero. He's a vet. He's done great work here." And the chief of staff, this guy Rajan in the VA, had him fired after doing a peer review that was never made public what the accusations were, and this question of sham peer review as a power trip by a supervising chief of staff or somebody else. So can the tools of impairment reporting be turned against us as a political attack? And it's happened. And so the question is, how do we police ourselves so that doesn't happen?
Yeah.
And we may not have the answer to that, but remember, it's not always cut and dry. There are false accusations, et cetera. Like anything, these are human beings, and there's politics and weird people and borderline, there's personality disorders and all of that. So anything to add to that?
Well, as Tom just mentioned about the diversion program, California has no diversion program, like almost every other state. And their reply was that as per a statement of the California Medical Board website, the medical board concluded that the diversion program was not sufficiently effective to ensure the safety of patients under the care of an impaired physician in diversion. So the program was eliminated.
Yeah, so that's a way of saying, I don't know what that's saying, right? It may be saying that they don't want to do it. Maybe there's a physician lobby that said we don't want this. Maybe, who knows?
Yeah.
Physician lobby is quite powerful and at the same time completely ineffectual. So we're stuck in this catch-22 where we want to have the best possible ethics, the best outcomes, the best support for each other, but at the same time we're being pushed on all sides. So it's very, very difficult. I want to read something. So what happens when this stigma about reporting becomes a problem for a physician or any healthcare professional? And it's totally missed until something horrible happens.
Yeah.
So, and you have experience with this, and unfortunately many of our fans on Facebook do, because I've gotten a lot of messages about this case. This was, the headline was, surgeon shot dead his children, 9 and 5, then himself because he, quote, feared they would inherit depression. Now, let me get into this. Dr. Christopher Dawson, 36, was found dead by his wife, Rachel, alongside their children, Aubrey and Luke, in Texas. This was earlier this month, like December 9th or something. Now, just let that sink in. I've talked about the distinguishing characteristics between empathy and compassion. If you feel empathy, you feel the pain of this family, you will not be able to function if you're a parent. If you have compassion, which is love in the face of other people's suffering and a desire to relieve suffering, you will look at this and say, we must never allow this to happen again. And what happened? I want to read you Christopher Dawson, Dr. Christopher Dawson's obituary that appeared in the Star Telegram. And I want you guys to let me know what you think about this, because we don't know who wrote this. There was a lot of speculation who wrote the obituary. And I remember he's survived by his wife and his parents and all of that. So Christopher Chad Dawson, North Richland Hills, Texas. On the morning of Saturday, December 9th, 2017, Christopher Chad Dawson lost the battle with severe depression. After years of suffering with anxiety, depression set hold, and Christopher was unable to escape its clutch. He found happiness in teaching his son Luke sports skills and watching him at sports games. He helped Luke through a lot of his anxiety. So Luke, the child, had anxiety, but was overwhelmed with the thought of Luke growing up to be like him. Bree, the daughter, was his little princess, and he never wanted to go to bed without a kiss and a big hug. His children adored him, and he adored them. Chris worked hard to overcome his anxiety. He obtained his business degree from TCU before deciding that he wanted to commit his life to medicine. He sacrificed fun, free time, and relaxation to receive his medical degree at UTH-SCSA. He then took on the challenge of a surgical residency in Phoenix, Arizona. Between his ever-present anxiety, long work hours, and intense stress, the Chris we knew and loved began to fade. Chris and Rachel started having extreme marital problems, but the children were always loved above all. He managed to make it through his residency, but was damaged and attempted to self-medicate his hurt. Already we're seeing signs of impairment that even the family was seeing, that other people were seeing, right? Yeah. He fought to get out of the deep, deep hole he was in, but was afraid the repercussion of his career if he were to get professional help. Listen to that again. He fought to get out of the deep, deep hole he was in, but was afraid of the repercussion of his career if he were to get professional help. Again, we have a surgeon. Think how scared your surgeon was to tell his doctor that he started noticing a tremor. I mean, it's the end of everything that he's worked for, right, in his mind. He felt hopeless, worthless, and trapped. Now, and to follow up on that, and yet now you suffer with complications that are lifelong because of that failure to report. So if you're looking at compassion, the suffering that has been unleashed by failure to report is immeasurable. He felt hopeless, worthless, and trapped. On Saturday morning, while not in his right mind, he did the unimaginable. But that was not the Chris his family and friends knew and loved. Chris was an intelligent surgeon, a loving father who had so much to offer the world. But the sick disease of depression, anxiety, and addiction did not allow him to continue the journey. He survived by his wife, parents, etc. So this is one of our own. This is a doctor who struggled with this stuff, who didn't report, right? Who this horrible tragedy happened that they're never going to recover from fully. And again, it's a failure of compassion. To be compassionate to ourselves when we're suffering, to get help, and be compassionate to our patients, to report others who are suffering, and compassionate to these children who lost their lives because this was not managed.
Now, Z, let me compound this and make it further more complicated. Melissa says, I reported a nurse and she ended up being charged with theft of narcotics instead of diversion, and she ended up losing her license and then committed suicide.
So there are a lot of Z-Packers who want to treat drug addiction as a criminal event and as some sort of moral failing. And whatever you feel about the moral failing part, treating it as a criminal event, and I will go on record with this, is absolutely the wrong answer. It's the wrong answer. Do you agree? I mean,
Yeah, absolutely.
You two are both pretty conservative. I'm pretty moderate. Whatever your politics, I think throwing somebody in jail
Oh, absolutely. No.
for this crime of use or diversion seems crazy to me. When you can, there's shown treatments that work.
Absolutely.
Have you had to deal with quite a bit of this as a psychiatrist?
This was in the 70s during psychiatric residency. There were two psychiatrists. One we knew was schizophrenic because of the flat affect and the circumstantial speech and the hallucinations. We all ignored it. He hanged himself in the basement of the housing there at the hospital. The second one was a psychiatrist around my age at the time with a 5-year-old daughter, suffering depression. She drove herself and her daughter off the bridge and killed them both. And we feel, and to this day, I feel we could have done something. We should have done something. And now we know that we can and we should. Compassion, be non-judgmental, talk to them first, and then do something.
What is
Make
the use
sure
of
they
it?
get treatment.
You can talk to the chief of staff.
But of course,
You can talk to license board. So these are the two things. Besides, helping the person for depression, alcohol or drugs, 70 to 90% of alcohol and drugs can be cured.
So in other words, 70 to 90% of treated
Yeah.
addiction like that in this setting can be cured,
Yeah.
according to the data that
Yeah.
you saw. Yeah. So guys,
But dementia, of course.
right, well, dementia is tricky.
yeah.
Dementia
But-
means recognizing and understanding that your career needs to wind down very quickly and you need to get treatment for that, which means finding a good caregiver, support, all the things that we struggle with. And you guys better not get dementia because I'm not taking care of you.
I think we
I'm
already
extremely
have.
busy.
Oh.
My sister will have to be deputized.
Oh.
I will send gobs of non-existent money.
She will euthanize us. That's what she will do.
You guys think she's kidding. It's entire. If my parents are ever euthanized, you need to go after my. No, I'm kidding. You know, and again, not to belabor this, but so yesterday, physician takes his own life at Frodert Hospital as SWAT team responds to suicide threat. 43-year-old physician took his own life. I believe it was an anesthesia resident, actually, and barricaded himself in a room, and they found him, and they're waiting on autopsy and all that. Now, like, this is a treatable, preventable tragedy, and we in healthcare who pride ourselves on being smart and using evidence and having compassion fail consistently.
We do.
But we don't have to. We don't have to.
Exactly.
The point is we know better. Now we know better. Your elephants know this now. We need to go forth and do the right thing, which are all the things that you were talking
And
about.
this is important. We know better now. Back in the day, we really didn't. We were practically stupid then.
Mm-hmm.
We saw
Usually-
things and did nothing.
Usually hospitals have physician health programs.
Right. Now, see, the problem is a lot of them are this, oh, you should do some mindfulness and maybe do some meditation and take some time off and recharge your batteries. They don't address oftentimes the fundamental problem, which is workload, responsibilities out of proportion to ability to handle it constantly, without having the resources to manage, without the support, without the culture that supports us. And then if there is mental illness, getting actual treatment. Because sometimes you're going to need medication, you're going to need therapy. If you don't get that, you can meditate yourself into oblivion. It's not going to cure the
Exactly.
problem, as you know.
Yeah.
So, I mean, in third year medical school, I was horribly depressed. Terribly depressed. But everybody was. You
Yes.
were depressed.
Oh, I know that.
You did
I wanted to quit.
a pathology internship.
That was the worst. I mean, I think I was almost psychotically depressed. And the minute I decided, let me follow my heart, do what I've always wanted to do, psychiatry, that was the end of the depression.
Now, you were pregnant with me while being psychotically depressed as a pathology resident. So you exposed me to
that was your
stress
sister.
hormones.
That was your sister.
Oh, was it?
Yeah.
Oh.
I had you during my internship.
Oh, that's a lot better.
Oh, it was much better. It was much better.
Then I wonder why I'm so neurotic. Anything to add?
Well, how about these malpractice insurance companies? Do they screen candidates before giving them insurance?
I bet they don't. It sounds illegal to me.
At least NorCal in California does not.
So they'll insure you, which I think that's good, right? We don't have pre-existing conditions in medical insurance anymore. Why should we have that in malpractice?
They don't.
One thing I want to say about malpractice insurance, folks, if you've ever dealt with them, they are there to support physicians. They're there to give you resources. Like my dad learned a bunch of stuff from his company NorCal doing their CME about impaired physicians. So they actually can be a very good resource to learn quite a bit. I recently did a CME because you get a discount on your malpractice if you do their CME.
Yeah.
So I did a couple of units about the business fraud in medicine, and I learned a lot. I learned, first of all, me, Tom, and Logan are committing extreme business fraud on a daily basis.
Oh my goodness.
Non-medical fraud.
And Medicaid fraud, because I have 3 walkers in the front window, so if the IRS comes here, it looks like it's legit.
I love that we're running a DME, a durable medical equipment scam, because it's like the least lucrative scam we could
I
possibly
know, and
run.
we're not even in Florida, Z.
I know. There's like 3 old people in Las Vegas. Actually, that's not true. A lot of people come here. Actually, that's a good. You know what? We were talking about like diversifying this enterprise, ZDogg Industries. I'm thinking durable medical equipment might be the next thing.
I'm into it.
Can I get a loan?
He's the boss.
Oh
He's
yeah,
the banker.
he's the boss when I ask for a loan. Otherwise, you're the boss.
Well, I got a good comment here for ZDadd, which is, I worry. Katie says, I worry more about aging physicians that don't want to wind down but show physical and/or mental deficits.
Very true.
I'm sure it's hard to realize this about your own self and let go of a career that truly defines you as a person. But patient safety should be #1 in my experience, and hospitals don't have good ways of dealing with this. So you said that you had a physician who actually harmed you, and as you've gotten older yourself, have you reduced your scope of practice?
You have.
Yeah. I have reduced my complete exposures to treating patients.
Now it's evaluation.
I just do evaluations.
Right.
And when did you notice that you needed to reduce your scope?
Well, at the age of
I think he was 68.
around 70,
10
I
years ago.
decided to quit.
Was it 70? Yeah.
Basically like retirement.
Yeah.
But then I decided that I should do something on a part-time basis,
Why?
just to keep busy,
Yeah.
That's
Yeah.
good.
keep your mind going, so you don't get dementia.
Yeah, but this is important. We need to know our limitations. And by the time I reached retirement age, I was getting very irritable and very a little bit depressed and anxious, and I knew then that wasn't right, not for my patients and not for me. And so then, slowly and steadily, I kind of rehomed all my wonderful, beautiful patients that I still miss, and then I quit. I didn't quit. I started taking care of a new grandson.
Which is a psychiatric emergency in itself.
Absolutely.
Yep.
Much more challenging.
It's all access too.
Very much so.
Excellent. Tom, any other comments, thoughts?
No.
Any other?
What about
Uh-oh.
impaired physician versus improper care?
How do you distinguish whether someone's impaired or just an idiot? Is that what you're saying?
Yeah, impaired care.
So what's just straight malpractice and stupidity, or not practicing the standard of care? Which, by the way, the standard of care is a lot of times stupidity. We just don't know it yet. What's your point? How do you distinguish them?
Yeah, how do you distinguish?
I don't know.
Yeah.
Yeah, I mean, it's all the things you talked about, I would guess.
Yeah.
If it's all those things, you just sense that this person is impaired from other issues, like the surgeon who did the cystic artery thing.
Yes.
They didn't know he was an alcoholic and a drug addict,
Yeah.
or suffering from addiction. We don't say addict anymore, it's not PC.
Yeah.
Got to say like suffering from addiction.
Oh, absolutely.
So we're all about PC on this
Gotta
show.
be, also be, yeah, of course.
Yeah, exactly. That's why Logan is Latino American.
Is that right?
And Scotto Latino American.
Very important.
Tom is Caucasian American.
Yeah, I'm just pure white. I'm as white as you can be.
That's the least PC thing.
Isn't that the truth? Oh my goodness.
So basically, if you're going to report somebody, you have to be very, very sure that this is not impaired professional practice,
versus
poor
practice.
poor practice.
Right. Okay. Well, how do you? Yeah, that's gonna. And again,
That's
that
another
shouldn't. That either way, you should be concerned about this doctor. Either way, you should have a conversation with the doctor and maybe the superiors or who. And I don't want to limit this to doctors. Everybody, nurses, nurse practitioners, PAs, everybody who touches patients, and probably some people who don't touch patients, like administrators, are rather impaired. And you've seen evidence of it, and they're making poor decisions, and those decisions affect lots of lives. So let's not limit it just to frontline clinicians. Other thoughts? What are you guys having fun in Vegas? You're going to go home tomorrow?
Yes.
What about HIPAA? How does HIPAA
What
fit
do you mean
in here?
HIPAA?
You mean HIPAA? HIPAA, I told you that I like her. What about HIPAA? Does HIPAA, this is actually a good question. Does HIPAA apply to reporting a physician who's impaired?
It really doesn't, because you're not treating that physician.
That's the key thing. If you are treating that physician, you're under HIPAA, you're a covered entity. If you're not treating the physician, you can report. Now here's the thing, if you are treating the physician and the physician refuses to get treatment for their impairment and continues to practice,
Or insists on going back to practice.
right, you still might be ethically obligated to report.
Yes.
And look at your state laws, but just understand that HIPAA or not, this is a safety issue, and you might be ethically required to report.
Yes, exactly.
So you're not off the hook. HIPAA doesn't protect you from this, and in fact, you might still be in hot water if you don't. And ethically, it's not quite right.
And you can be sued.
You can be sued.
You can be
But
sued
in
for
the
anything.
Yeah.
courts, they will look at you favorably because you have an ethical obligation in protecting the patient.
Right.
And protecting the doctor too against harm.
So what you're saying is you can be sued if you report a doctor, okay, for impairment, but usually in court, they're going to look on you favorably because of the ethics of it. So anyone can sue you for anything. You can be sued for libel or slander or whatever it is. Tom knows the difference between libel and slander, a son of a lawyer. And
Oh, is that-
Slander is spoken, Z. Libel's in print.
so basically I'm mostly slander with a little libel on the side.
Yeah, you're slanderous.
But I've said bad things about Dr. Oz, none of which aren't true.
Oh,
None of which
zoom in,
aren't true.
Oh, I'm a fan of him.
My mom loves Dr. Oz.
Yeah.
You like Dr. Mike too.
I certainly
I
do.
like Dr. Mike. Dr. Mike is like a better Dr. Oz. He's more handsome,
That is true.
he's more scientifically accurate, and he's more younger. All those things are okay with me, 'cause I'm an ageist.
Laura Walker says medical professionals are mandated reporters. So,
Yeah,
I mean,
yeah. And again, talk to your local ethics committee or look at your local laws to see what's required of you. But either way, you kind of know, all right? So
Now, if you're a chief of staff and somebody brings this complaint to you or a member of the board, are you protected? Yes, according to NorCal in California,
Yeah.
you have to make sure you get additional coverage to protect.
malpractice insurance, yeah.
Besides the usual
Right.
malpractice,
Right.
there is the other two categories that you should be. If you're a
Leader, physician administrator.
administrator.
Mhm, yeah. So again, and you'll notice what my dad tends to focus on are these issues of liability, because how many years in practice you're always worried, is somebody going to sue you? And you actually did great in a career. I don't think you ever gotten any malpractice
No.
issues. Yeah.
No, none at all.
That's really unusual. Really
Yeah,
unusual. It's a testament to developing relationships with your patients.
Very important.
So that you can hide your mistakes, sweep them under the rug, and lie about them on the stand.
And the physician that is least sued is a psychiatrist because of the
Is that
patient.
true?
Yeah.
Is that really true?
It's the truth
I didn't know
because of
that.
the patient,
The bond.
doctor bond and relationship, and the
This is,
time we spend with
to
them.
bring some humor in this talk, I was
Good luck.
I was actually sued once,
Yeah, but
and you won't believe why.
Why?
A patient came in and told my secretary, "You fat bee,"
yes,
Called your secretary then?
yes,
Yeah.
the secretary.
Oh,
because she.
I didn't know you had a secretary.
Yeah, yeah, my
So for
goodness,
whatever
I remember
reasons.
that case.
So
yeah.
the
And then what happened?
patient went outdoors,
Yeah.
and from the window she was screaming, "Fat bee,
Oh.
fat bee." So my
The word is
secretary.
bitch, by the way.
Oh,
'cause,
oh.
sorry, I can say it, he can't.
Oh,
So my medical secretary lost her cool, went outside, and something happened.
Uh-oh.
and the patient fell.
No, they got into a cat
So
fight.
she put a sued me.
Yeah, for millions of dollars.
Ah, right.
Because
I remember this.
I
Yeah.
told my insurance company it happened outside my premises. It didn't
Right.
happen under my roof.
Right.
I remember.
But they said, well, she's still your secretary,
course.
so we have to go
Yeah.
through the
Yeah,
process.
yeah.
Mhm. Because you're responsible for
Absolutely.
screening her for her conduct
Absolutely.
on the facility.
Yeah.
Yeah.
And she never had, the patient never had any injuries, so the lawyer wanted $12,000
Settlement.
at settlement. I told my lawyer, I'm not settling this case.
Oh, snap. So then what happened?
I am going to fight this.
I
till
never
the
heard
end.
the result of
Yeah.
this. Okay,
Yeah.
so what happened
So I was all dressed up to go to the arbitration judge.
with this?
Everything, I was dressed up. Then the lawyer calls me and he says, "Hey doc, forget it. We're
Case
going to pay him
dismissed.
$2,000 and forget about the whole
$2,000.
thing." Yeah.
And that was it.
That was
and
it.
the girl and the patient didn't get
Patient
the
probably
2,000. The
got.
lawyer got it.
It all went to the lawyer.
Yeah.
That's how it works, Tom
But-
Heimer.
That's
But
right.
remember, this went on for 8-9 months.
Yeah. More than that.
You have to get depositions and
And all the opportunity
Oh,
cost
it was
of being
bad.
away and the stress. I remember you were getting ulcers over this. And because, again, it's like you're getting sued by this patient who's, first of all, is calling your secretary horrible names. Only
Fat
70% of which were appropriate.
yeah.
And then you have to go.
Yeah, but she was sued too. The secretary was sued too.
Oh,
and then
but did she
quit.
do okay? Did she?
She went into a deep depression,
Oh.
and then she didn't come to work, and she quit.
Look, how many times has a patient yelled at us and we've wanted to take them outside and just, school them? You can't, you shouldn't, you don't, because we're professionals.
But
sometimes people snap.
yes, and I have been very guilty of that. But for me, it worked.
What do you mean, what? You beat up patients?
No, no. No, I've yelled at them.
Oh, yeah, sure.
I mean,
Yeah.
really yelled at.
Right.
Stop, leave. That's not appropriate. You've got to sometimes set limits.
Hey, good.
I mean-
Peter Gallagly, I did a piece on
Yeah.
him. He's an emergency doc in Florida. Viral clip. This patient went in. Apparently, this patient was yelling obscenities
Yeah,
at the
yeah,
staff,
yes.
threatening to bring her big black husband in to
Yeah.
beat everyone up, demanding to be seen, etc. So he finally snaps, comes out and says, "Get the hell out of
Yeah.
here!" Blah blah blah.
And it works.
And it went well. The problem was the daughter was like, "Mom, I got this on camera."
Yeah.
Made it viral. Made it viral. Did you think I was doing a racist accent? It was a white chick.
Yeah. Oh.
My mom reads a lot of tabloids. You need to understand this. So then at this point, it goes viral, and everyone's like, "This doctor is a monster. He treated this patient like this, who was just waiting for an interruption, waiting for a appointment."
Yes.
And everybody was piling on him. So you know what we did? We did a video defending him, saying, "You know what? Sometimes, as Kenny Rogers said, sometimes you got to fight
Yeah.
when you're a man." And he never laid hands on her, although he did take the daughter's phone, which was probably a
remember
no-no.
that, yeah.
And it made national news. And we know what? We started a counter movement where people came to defend this guy, and we're very proud of that because, again, we got to support each other in service of the patient. This patient was actually not, according to the full police report, was not behaving in a way that was conducive to other patients getting good care or her own good care. All right, on that note, guys,
Wait,
no.
I just want to mention.
Oh, gosh.
What is it?
I've been trying to end this cast for like the last 15 minutes.
What did we learn today?
What did we learn today?
Basically, is ethical considerations, safety of the patient.
That's the bottom line.
Yep.
That's worth repeating. It's about our patients, right? If we take care of each other, we support each other, but also have tough love and compassion when people need help, then we support our patients, and that's the best we can do as healthcare practitioners in a 3.0 world. And on that note,
Now, wait, I just want to end the talk with a little humor.
oh, good Lord. Hashtag dad joke, do you have that?
What is it?
We can cue it up.
I
Cue
didn't
it up.
A patient goes to see his doctor,
Here it comes.
and after the examination, the doctor says, I have some bad news for you and some good news.
Yes.
And the patient say, "Hey doc, give me the bad news first." And the physician says, "You got Parkinson's disease, congestive heart failure, severe arthritis, irritable bowel syndrome, and Alzheimer's." And the patient says, "Oh doc, that's awful. What could be the good news?" So the doctor says, "The good news is, within 1 month, you'll forget whatever I've just told
Oh,
you.
Lord.
So that's just humor.
That is just humor. Do we have that dad joke hashtag yet?
It's coming.
Okay,
it's
bring
coming.
that. See, what makes it awkward is how long you have to wait for the dad joke hashtag to actually appear.
Wait.
Because I'm not leaving until that hashtag comes up.
Before we go, I want to know what ZMom and ZDadd bought each other for Christmas.
Oh yeah, what was the Christmas present? Did you get anything this year?
Yes.
We gave each other love.
No, I don't know about that.
oldest excuse
I
in the
gave
book.
him, he needed socks.
Ah, that's a good present.
Z wife gave me socks.
Yes.
Yeah, and they were great.
Yeah,
Yeah,
he-
Banana Republic.
He got socks and a T-shirt that said "Life is an adventure every day," and I got some
Dad joke.
good hard cash.
Good. Good. Well, I'm
Wonderful.
glad that the love is still there after how many years? 50 years?
Almost.
Almost 50 years.
Yeah. 50 years. Yes, of meeting
Of meeting.
and being engaged,
Okay.
and the
Right.
2 more years for the big one if we're around.
You'll be around.
I hope not.
You better be.
Oh, thank you.
I don't want that inheritance until the tax laws are more favorable. don't die this year because the estate tax changes next year. All right?
yeah.
10 million. You don't
20
have that.
million. No, we
But I
don't.
can dream.
Yeah, you said you can.
On that note, Z-Pack, thank you so much. Hit follow. Wait, yes, ma'am?
Yeah, no, I
You-
thought you were going to adopt me. No, that's okay.
You never know. I could win the lottery.
Okay, let's
Come
give
to
them-
me after that happens, and we'll have a discussion about estate tax planning. Hit follow if you like ZDadd and ZMom. Let us know if you want them back. Thanks for all your comments and the great discussion. Please, please, please share this with people that you care about because we want to raise awareness about this, especially the epidemic of suicide among impaired physicians and other healthcare practitioners. We're not just limiting it to doctors. It's just that's been the conversation in the national news lately. And on that note, Tom Heineber,
Bye-bye.
Wait, I want to tell a dad joke. Hey Z, where do baby apes sleep?
where Tom Heineber?
In apricots.
I hate you so much, Tom Heineber.
I pretended I understood that.
Oh, wait, come back. So you got to understand this real quick. Today, Mrs. Dog's parents, my in-laws, and these two, we all have lunch with both families at Dim Sum Cafe. Margaret's mom,
Yeah.
my mother-in-law, says, oh, in Italy, this is what old people talk about, currency and the weather. In Italy, before the advent of the euro, they had the lira, and they were so tiny, you had to have tons of lira. And-
It's lira, Z. Anyway.
No, all right.
I hate you, Tom Heineber. So the lira, and so my dad says, you don't pay by counting money, you pay by weight. And everybody at the table stopped and was just like, nobody got the dad joke except for me and my wife. And we were like,
Yeah,
and everybody else like, no, you don't weigh it. You just
and I said, really?
That's true. In Venezuela, they weigh the money.
That's true.
make it stop, Tom Heineber.
Wait, one more joke. Yo, Z, knock, knock.
Who's there?
9/11.
9/11 who?
You said you'd never forget.
Oh.
Uh-oh.